Good morning, everybody. We are here with Becky Montag, a licensed physical therapist, and we're going to talk today about hip pain, lower back pain, and some ways to get support and how someone like Becky would be able to help you. So excited to have you here today, Becky.
Thank you so much. So glad to be here.
And let's start off with what got you into physical therapy, what's your background in, all that good information.
Excellent. So I'm a licensed physical therapist. I started practicing in 1993 and was working mostly in hospital. And then in 2004, switched over to women's and pelvic health and have been doing that since 2004. And presently I'm working out of space at Bloomin Babies Birth Center. So I'm seeing their clients as well as others that are looking for women's pelvic health physical therapy.
So what is it that drew you to women's pelvic health specifically? A lot of stuff, important things happen down there, but sometimes it's something that we don't talk about, but it sounds like it's something you're passionate about.
So very true. So as a young therapist working in the hospital, it seemed like a great majority of my time was spent helping patients get the functions of bowel and bladder working again and being mobile enough to be able to get to the bathroom safely and get back to their bed or chair. And so through that experience, I just realized how impactful incontinence is on a person's life and how we need to, especially as women, really be in tune with our pelvic health, especially through pregnancy, postpartum, and through the aging process. There's so many changes that happen in the pelvic area of our body, and they are impactful on nearly every activity of our daily lives. And there are so many simple, small things that we can do, just being aware and taking care of our bodies, that will help us to remain healthy in those areas throughout the aging process.
Yeah. So I want to give you an opportunity to share some tips and stuff, but I
Sure.
want to get really specific about some of the things that we're talking about that, like, we're talking about if you pee yourself and you didn't mean to, right?
Right.
Or like you feel like you always have to go to the bathroom. Like, I want to be really honest about what we're talking about, things that people don't really normally want to have a conversation about, but they're experiencing and spending years like living through, right?
Mhm. Absolutely. Women like to talk and to share, but about these issues, sometimes we're not as upfront with our friends and family or our providers even may not know that these are issues that we're dealing with. And I want everyone to know that there is hope. This is not something you have to live with. There are things that can be done, and it is not always invasive or surgical or anything like that, but there are small steps that we can take to improve our life.
Perfect. So, why don't you go ahead and give us one of those tips that you share with people that they could do to help themselves with a common problem that they face?
Okay. So, some of the most common things that I address with clients during pregnancy are back pain or pubic symphysis pain, which is pain right in the front on the bone, um, right above the pelvic floor. So many women will come first because of pain. And that is the thing that triggers them finally to, I need to get help, I need to get care. So one of the very first things I look at is posture. How we're standing, how we're sitting affects the alignment of our pelvic floor. And so if our bones are tilted in such a way, or we're always hanging out on one hip, then our pelvic floor is not able to work in the most efficient manner that it was meant to or designed to work. And so first off, I'm going to look at posture and encouraging women to stand with what we call a stacked posture. So shoulders are over hips, over knees, over ankles. And with pregnancy, our weight tends to migrate our center of gravity forward, and we compensate by kind of scrunching up our low back. And then that creates a lot of tension across the low back. And there's two little joints there called the sacroiliac joints that, because of the hormones during pregnancy, relaxin hormone is loosening some of that soft tissue. Then our alignment can be even more shifty. And so say we go to roll out of bed or to get up from a chair, and we get a shifting going on, and it can create pain either right in the back of the pelvis or in the front. And so one thing I encourage before women will try to roll out of bed is to take a gentle inhale and just take that breath in. Then as you start to exhale, engaging pelvic floor just slightly. It's not a hold your breath, hold as tight as you can. It's just a slight activation of the pelvic floor and the lower abdominals. And that gives the pelvis then some support so that it's not as shifty as you roll to your side and then come up to sitting. So that is one of the most important tips that I give, and also not holding your breath as you go through that process. When we hold our breath, we're rolling to get up and it hurts, and we hold our breath, we're just putting more pressure on that area, and it can create even more pain.
I never thought about it like that your center, your gravity, where all your mass is, right? It's shifting, and so then you may hunch more or be on one hip or something like that, and not even think about it, and that could cause pain. That makes a lot of sense.
Yeah, so a lot is just looking how we stand. How do we spend majority of our day? Or if we're sitting a lot, how is that posture impacting the muscles in our body, in our back, in our abdomen, in our pelvic floor? Is there extra tension in one area and not enough in another? So we just want to work on balancing that out.
It's amazing how important the pelvic floor really is, and something that we don't think about very often or consider.
No, we don't. That's very true. And it's impactful for our urination, our bowel movements, our sexual health, but also just our pain and function. It relates with our hip muscles, our back muscles, our abdominal muscles. They all work together.
Great. So if I was pregnant and I was experiencing some hip pain or some lower back pain, what would I do? What would it look like if I wanted to work with you? What would we do together?
Okay. So what I would start off doing is an evaluation of your past medical history and what's going on presently, how the pregnancy is progressing, what is your daily life like, what are the triggers or the things that are impacting maybe the pain or dysfunction. So we would talk through all of that, and then go into looking at your standing posture and your sitting posture, and looking at the muscles and the bones and the alignment to see how they're working together. Sometimes certain muscle groups kind of get turned off because others are working harder. And so we would look to balance that. So we would do some hands-on, just checking, looking at posture, looking at movement. Do you have full range of motion? How is your strength? And then we would go into some hands-on with you laying on a treatment table and looking at the very specific alignment of the pelvis, the mobility of the spine, and then talk through some activities that you could do at home. And we would go through them together, and then you would receive a handout of specific activities that you're going to do. I try to tailor it for each individual person and make it as user-friendly, because not everyone enjoys doing exercise, and a lot of things are more just activity changes in your daily life. So incorporating awareness into your day, or breathing, or relaxation, but then also paying attention if there's strengthening areas that need to have attention brought to them, then we need to strengthen.
That's really cool. I'm starting to shift in my seat and be like, what is my posture right now? Am I sitting up straight? What
There you
muscles
go.
am I using? What ones am I like not using or overusing?
Exactly. Are our shoulders up towards our neck, or did we just pull our shoulders back, but our pelvis is still in a slouched posture? So those are the things we look at.
So then it's also important to talk about postpartum, which is another time when we focus a lot on pregnancy, but sometimes we miss that we need to take care of ourselves during postpartum as well, especially after so much has happened in the pelvic region. So let's talk about postpartum. What would that look like? What are some of the common things that women come in with during postpartum for you to help them with?
Sure. So the ideal time that I like to see a postpartum mama is 6 to 8 weeks postpartum. Past that initial adjustment phase, there's been so much happening and your body has gone through so much change and you and baby are adjusting. So about 6 to 8 weeks post delivery, and that can be whether it's a vaginal delivery or a C-section. There are a lot of things that we want to address. And the very basic first thing we look at, again, is alignment of the pelvis and of the spine. When mamas are breastfeeding, there can be certain challenges with certain muscles being stretched and some being too tight. And so we look at that. We talk about how baby care is going at home. Are there any pains that are going on, incontinence that might still be present? We also look at diastasis or diastasis recti, and that's when the abdominal wall thins, and so there can be a little doming or a little valley when someone is getting up or doing a functional activity, and so we want to work on getting that corrected. Also, we really pay attention to the ribs and the upper spine and how that is all moving. As we're a new mama and breastfeeding or caring for a baby, we might be really tight and just holding here, and our ribs and our breath are just not expanding like they should be. And so we'll talk through that. If there's a C-section scar or a perineal scar, we'll look at that and pay attention to how we can get that mobilized. And that is an individual case-by-case basis. So that might not be that very first visit postpartum, but it might be down the road just a little bit. So it's really individual to each mama, but supporting them on their healing journey and returning balance to their pelvis and their body in general.
I didn't even think about like the impact of breastfeeding on a mama or now carrying around their baby and how that could also impact the pain that they might be feeling. What are some of the common like things that people say they experience pain around after having their first child?
So the biggest complaint generally after delivery is like mid-back, upper back discomfort, or just feeling like my hips just aren't working. They just don't feel like they're supporting me and that I can move. And so we really address those two. The hip discomfort can often be coming from the alignment of the pelvis, not specifically at the hip joint. So we'll check both of those out and see what's going on.
That's really cool. Super important. So do you have any other tips or things that you'd like to share with anyone who's watching, whether they're pregnant or older or younger, who may have like alignment that isn't perfect or maybe experiencing some of that little pain that we've talked about?
Yeah, I think the biggest takeaway I would give women in general is that your body does amazing things for you, things that you can't even imagine, birthing a baby or going through a major transition. And we need to tune in to our body and to know what's going on. Listen to the signals that it's telling us, the little yellow flags of, hey, pay attention. I'm not working quite right. And paying attention to that and then seeking out help to be able to have guidance on how to help heal and to maintain balance and health throughout the different stages of life.
What are some of those really common signals? Is it pain?
Pain is one. Incontinence is another one. So leaking urine or leaking bowel. And those are things we need to pay attention to. They can be common during pregnancy, postpartum, but they're not normal. And so it is important to address those. Also, it can be just weakness. And women who have been really active and really fit and then have a baby, and then they want to jump right back in where they were. We need to be cautious and build a great foundation first, and then return them to that activity that really helps their mental health. And so, but we want to do it safely. If there are complications with delivery or a separation, that diastasis, we want to be sure that we can heal the pelvic floor and the whole core, the deep core and the outer core, to be able to sustain functional activity and return to sport.
That's a really good reminder that of all the things that our body does for us, and acknowledging when we need some additional support instead of just continuing to go to the bathroom every 20 minutes or something like that.
Exactly.
Just get into a habit of and are like, this is my normal. I can't do anything about this. So we can change it. And also acknowledging that after birth, that's a huge accomplishment, and that it's okay to take the time to heal, and that your body needs some additional support from someone like a pelvic physical therapist like yourself.
Absolutely.
Perfect. Okay, so if someone wants to work with you or wants some support from you, how do they go about setting up an appointment?
Sure. So my website is montagphysicaltherapy.com, and my office number is 970-235-1938. And I am in a renting space out of Bloomin Babies Birth Center, so that's my primary clinic spot. And so I look forward to anyone reaching out. If you have questions, reach out by email, text, or phone, and I will get back to you and look forward to working with you, or just answering questions. If there's something that you're just unsure about, just reach out. There are no dumb questions. We're here to work together and to help each other along this journey.
Perfect. Real quick, because I made this mistake, can you spell your last name?
Sure.
Because I added an extra letter to it when I first saw it.
Sure. It's Montag.
Perfect. Okay. Thank you so much for being with us today. I really appreciate you answering all of our questions. And if you'd like to get in touch with Becky to work with her or get some questions answered, please reach out. And we look forward to talking to you guys in 2021. Hopefully it's a better year, right?
Yeah.
Take care, everyone.
Bye-bye.